You're listening to the Veterinary Innovation Podcast.
You're listening to the Veterinary Innovation Podcast. My name is Shawn Wilkie, and along with my awesome co-host, we interview the innovators in this space every week. Ivan, please go ahead and introduce today's guest.
Hey, I'm Ivan Zach, and I'm excited to introduce you to Yale Zhang. The topic is innovations in workflow through connected devices. Ooh, we haven't had those in a while, so this is exciting. Yale is a co-founder and CTO at Mella.ai. He's a founder and CEO of Safe Heart USA, owner of Mandarin Enterprises, his degree in industrial engineering from Georgia Institute of Technology. Fun facts, he's a first-generation immigrant to US who was inspired to pursue medical distribution devices and transportation with the goal of giving greater access. Welcome to the show, Yale. Thank you for finding the time.
I'm happy to be here. Thank you for inviting me.
So can you tell us a little more? First, I want to know, what is the Safe Heart USA?
Well, over 11 years ago, I had in the midst of working on the first startup that I had in medical device distribution, we had a customer call in who said, "I really want to see my results in a better way than the tiny little screen that's on my pulse oximeter." And I said, "Well, how would we do that?" And she said, "I'd really like to see my results on my phone." I said, "A phone oximeter? That sounds like an amazing idea." And so 3 months later, I put together a team and it became Safe Heart USA. But through the process, I was able to build a really great team in China that is now able to come together again to build healthcare products for pets through Mela Pet Care. So it's really a springboard for getting me to where we are.
Yeah, that's so awesome, Yale. And I know a bit of your backstory and your co-founder's backstory. I've had the pleasure of meeting you guys and hanging out a bit. Let's jump into that in even a little bit more detail. So this is your team's second startup. And what's it like going into the second one, coming off a successful first one?
I would say, you don't really get to know your co-founders unless you've had the midnight giggles, right? And the way I say that is where, you got maybe some half-finished containers of Chinese food, maybe you're working on a pitch, and then there's that moment where everybody looks up and looks at each other, and you just start randomly giggling because you're all still together in the office working really late, but you're passionate about what you're building. And so that same feeling, it's really hard to come by, right? It's like a marriage. So that's when the second time came around, and Anya, the founder and CEO, as well as Ben, the co-founder and chief operating officer, all came together and said, "Hey, why don't we take some of these healthcare ideas and bring them to pet care? Oh, and by the way, here's an invitation to Global Pet Expo. You should go check it out." I jumped on the next flight down to Orlando. So the key is, more than just co-founders. You really have to start from, are these the folks that I wouldn't mind hanging out with, even if we weren't building a company together.
Yeah, that makes total sense for sure. So catch us up to date on your guys' startup. Where are you guys at from a distribution perspective? What is it that you even do? Because a lot of people have been hearing about this for the first time.
Well, so Mela Pet Care, it really stems from an extension of creating some enhancement to some of the technology, some of the ideas that we created in human healthcare, made specifically for pets. But everything is it's a rethinking across the board of how to deliver better connected monitoring devices, and even that's too much jargon. So I'm going to make it very simple. We want to build better thermometers, better weight management scales, better pulse oximeters, just better diagnostic equipment all around, with the ability to connect to the practice management system and write to the patient record, and be able to empower the pet parents with the ability to make better decisions for their pets, because now they have a greater understanding and insight into their health.
So that's really awesome. So I'm a vet by trade. Shawn doesn't know how the vet clinic works, so don't talk to him. In the vet clinic, already envision how that could be really cool. And so, can you tell us a little more? Because the struggles that people are seeing along the way, because all of these little things that you have to do before you actually, put your hands on the pet, and then you have to enter your records. Shawn is doing something to help there. I'll give him a little bit of a plug here. So he's doing dictation of the medical records. But then if stuff was entered into the medical record along the way while the pet is waiting in the exam room or in the reception area, and then the temperature taken, so you're envisioning plugging into that workflow and all of these things are dropping right into the medical record. Is that how you're envisioning that?
Oh my goodness, if there was a way where a veterinarian or a vet tech can just open up Takatu and say, create a patient exam for Biggie, the dog, and then it creates a patient file in the practice management software. And the next thing he or she takes a temperature of the same pet. The temperature is automatically written into the practice management patient exam record for that specific visit, and then they do the same thing for a scale. They do the same thing, using the other devices that we're creating. That is the holy grail. And so, we're all, I would say, between Talk2 and other workflow management companies and our tools that are already able to write the data back into certain PMS systems that have integrated with us, we already have a lot of the pieces of the puzzle.
Yeah, it's like the future of pet health.
Not
Yes.
the talking to part, but so you're getting the second plug for your product here, Shawn. So tell me a little more about the techie part, because when I built SmartFlow, there was a lot of integrations we've done, and they were all sort of approach to every single PIMS was separate because there's no unified system, there's no HL7, there's no it's really hard in the veterinary domain. How are you finding that in medicine compared to veterinary industry? And then how does the tech work? Like, how do I take a thermometer, stick it in the butt? And then how does that fly into my medical record? Is it through, is it Wi-Fi? Is there how does those devices, how do they connect?
Well, first of all, no buts. Let me be very clear about that.
Ivan's incredibly disappointed all of a sudden.
It's actually, what we like to tout about the Mella thermometer is it's actually one of the first accurate axillary thermometers. And the way that we're bringing that accuracy on board is we're actually, because we have the integration, we're able to pull the characteristics from the patient into our system. So we control for breed, gender, body type. We also have control for age and body weight, and putting all those factors together in addition to our hardware. So the hardware itself has a triple sensor design. It takes the room temperature and then two separate measurements at the axillary position with slightly different positions. So by combining all of those data into a cloud-based machine learning API, it gives us a prediction of the temperature as if you did a rectal temperature measurement. And the accuracies right now, so the FDA requires an accuracy of plus or minus 0.5. Our accuracy, based off of just our own initial clinical trials, is already at 0.3. So it's already
That's cool.
well within the FDA requirements for efficacy of a axillary thermometer. And so it has a Bluetooth connection to a mobile phone, or if you use our Mella desktop application on a Windows PC, you can also have it connect to via Bluetooth to your PC. So either way, it'll stream the data to either your mobile phone, tablet, or your PC. It'll stream the temperature recording to our cloud, and then it'll give you an actual prediction that then is able to write to the patient management system. So the patient management system, that is the hard part.
Yeah, it makes a ton of sense. So give us a little update on there. So who do you currently integrate with today?
Well, we have a bilateral integration with Vetspire. And Vetspire, Sam over at Vetspire has really been the most amazing partner. They've given us all, a tremendous amount of technical support. Their system is already inherently easy to integrate with because it's just GraphQL. So that's made it really like a walk in the park to integrate with them. Now, there are some other systems that do support bilateral integration like EasyVet or Hippo. We're still in the process of working out those relationships with them. If they're listening in the audience, love to keep that conversation going. But the legacy softwares like IDEX or Covetras, they're going to be the ones that are going to be a much greater challenge because neither of them feature the ability to write back. So you still have to do a hybrid process where you're copy and pasting our temperature measurement into their window, which kind of honestly defeats the whole purpose because we really want end-to-end integration. That's the holy grail.
Well, I just wanted to say that to just follow up and promote this to other PIMs. If you're not promoting this integration with Mella, you're subjecting all the patients in the clinics where your software is to anal thermometer measurement. So please provide this integration to Mella Pet Care. Like, how do vets perceive this? Because this is like historical. That's, everybody knows that you take the thermometer up the butt. How did you guys think, okay, this is going to be, this is different? Because animals are not stressed out when you do that. Cats love it the most because they, this is where you fight with them the most. Try to then, the glucose is increasing, the heart rate is wrong, everything is wrong because you stressed out the pet. That's why you do it last. But can you do it on cats? That's another question. And then how do vets perceive this? Like, do they trust the axillary temperature rather than the rectal?
Well, see, that's the beauty of our devices. That we actually have a modular design. So it comes with 3 different probes in the box. You have a rectal probe, as well as an ear probe and an axillary probe. So if you don't trust it, you can always swap out the probe and try it again with a different probe using our same device. So that's where, even if you're hesitant about axillary temperatures, you can see with your own eyes that this is going to yield a accurate measurement. And on top of that, so to answer your question about cats, our prediction model for cats is actually more accurate than our prediction for dogs.
Wow.
Because it turns out cats have less variability in their body types, because the axillary temperature is actually mostly affected by how much adipose fat tissue is between the axillary artery and the skin surface, and that is actually more consistent across the board for cats versus dogs. So it's actually easier to take temperatures on cats using the Mella device than with dogs.
What does the Mella company look like in 5 years, Yale? Where are we going with this thing? What are you guys up to? What's your vision?
Oh, I mean, I could try to say that, oh, we're just gonna get like a SPAC with, Chamath Palihapitiya. He's gonna put like $1 billion into it, and we're gonna be publicly listed or something like that. No, but the truth is, we're really building the picks and shovels, right? The tools that are empowering every other type of platform, and no matter whether it's telehealth, whether it's traditional practice management software, whether it's mobile veterinarians, we are building the tools to empower all of them to be able to take better measurements. But simultaneously, we also have consumer versions of these tools that will allow the pet parents themselves at home to also take these same types of measurements, because everyone could benefit from this. So 5 years from now, what we envision is really as many pet parents and households as possible who are well educated, who are able to understand why it's important to have these tools, and then be able to have one for their pet babies. Just as if you're a regular human parent, no doubt you are going to have a thermometer for your human baby.
Yeah, that's awesome. So we started with thermometers. What's the vision? What are the next picks and the next shovels look like? Is there a roadmap already? Can you tease that out a little bit for us, or is that stuff that you'd rather not talk about?
Yeah, we can talk a little bit about it. And it was already kind of briefly announced as part of some of the publicity efforts and some of the partnership conversations we've had with pet food companies. And it's that we are working on a body fat scale that will also be able to measure the body condition through the use of electrical impedance. So it's not something where you have to stand on a scale with your pet. No, it is a floor mat that you just sit next to the food bowl, so that whenever they are feeding, they are being passively monitored, and then the measurements are being read. For the same time, for veterinarians, we have this improved pet scale for them as well, where it'll display for you the body fat percentage of the pet, as well as a predicted body condition score. So it's and my analogy is this, right? It's, if you're telling your kids to go to bed, you can say you go to bed, or you can point to the alarm clock and say, hey, look, it says the clock says 9 o'clock, you have to go to bed. Now, the second thing there is the kind of feeling that we want to give to empower veterinarians, where they're, instead of just feeling the body, the ribs, and say, oh, it feels like your pet's overweight and their body condition is 7 or 8. Instead of saying that, you can just point to the appliance which is called Biggie, and say, this thing is telling me that your pet, its body condition is at an 8, and that's really unhealthy. Let's put a plan together to do something about it. And that's in our own market surveys, people have said that that's far more convincing to help pet parents and veterinarians address the pet obesity epidemic. Ivan, I'm sure you have something to say about that.
So this reminded me about Avi Solomon, who was for a whole couple of months a product manager of SmartFlow at IDEX with me, and then he moved on to Modern Animal. But he trained Alexa to tell his son whether he could or could not have milk in the evening and all kinds of stuff. He coded Alexa to basically, he would, his son would say, "Hey, Dad, can I have a glass of milk?" And he would go, "Alexa, can he have a glass of milk?" And you're like, "No, it's after 9 p.m. You can't have a glass of milk." So he was like, until I think he was 4 or 5, until he was like, "Hey, I think that's you, Dad, doing that." So it just reminded me about that. So the vets can blame the device. So that's awesome. So from the distribution point of view, just on the business side, how are you guys moving out there? Are you talking to so right now, I assume you're B2B, so you're moving out into the vet space. Are you talking to PIMS as your distribution channel? Are you talking to big, distribution networks, or is it sort of, how are you selling? Are you selling to the vets, and what's the roadmap to the customers?
Well, I just want to say thanks to the efforts of really Ben Seidman, our chief operations officer. He has rounded up, just during the last year of not being able to go to any shows, over 500 pre-orders. So we want to work through them first and deliver them to our customers. And then after that, we do have a couple of distributors that have already agreed to carry our product as soon as it becomes available. Now,
Wow.
that's just on the B2B side. On the consumer side, of course, we got to go through the traditional B2C channels like Chewy and Amazon. And it's a separate version of the Mella that is only for axillary temperatures, and that's going to be for the pet parents. So we have B2B, and we also have B2C.
So Yale, if there's veterinarians listening to our show and they're like, "Oh, I'd love to get in on those pre-orders," like, is there still time to do that, or is that kind of ship sailed? And if people want to find out more information about the product, how do they do that?
Oh yeah, absolutely. Just go visit our website. It's just www.mella.ai, and Mella is spelled MELLA.ai. To find out more. Of course, we're always happy to accept more pre-orders at this point. You'll just have to wait until after the 500 initial devices have already been delivered, but we are coming to the market very soon. I can't say exactly how soon because we are trying to figure out the logistics, which, because they are manufactured in China, the logistics of shipping things from China have been all messed up by the pandemic as well. So we're trying to figure out which boat it's going to be on.
Awesome. Well, we ran out of time. Is usually just snaps so fast. I did want to say that for the first generation immigrant, your English is impeccable. I don't know if you're coming from English speaking country, but it's much better than mine. And this was very interesting and awesome. I really appreciate you coming on the show. And I hope that in the next 5 years, the vision is to have a bigger probe for Shawn. So we have 2 questions that we ask at the end. One is there a TED Talk video or a book that you recently read or listened to that you want to recommend to our listeners?
Well, Andrew Yang, who everybody may know, was a former presidential candidate. He's currently running for mayor of New York. But before then, he had a nonprofit called Venture for America, and he wrote a book called Smart People Should Build Things. And we really benefited because Ben Seidman, and this is going to be the third time I mention his name, but he is actually a Venture for America fellow that joined our team in our last startup. So he was employee number 1, and now he's a co-founder. And that's just how you can see how relationships evolve. So Smart People Should Build Things by Andrew Yang.
Awesome. And Yale, it's been an absolute pleasure to have you on the show. Ivan's had way too much energy today, so sorry that he's talked so much, but I apologize in advance. Last question we want to ask you is a guest recommendation. So another innovator in the veterinary space. Anybody come to mind that you think we should have on our show, and why?
Oh, absolutely. Absolutely. Immediately, I think about Dr. Lisa Lipman. She is actually a veterinarian for celebrities. Probably one of the most famous celebrities. Pets that she sees is Mariah Carey. But she also has been at the forefront of really helping us understand, there's humanization of pets, but then sometimes there's too many trends. So her biggest thing is always try to not do grain-free, and that grain-free is actually bad for pets. I'm going to say it again. Grain-free is bad for pets. And so it's she's got some really great ideas and just really great points on really how to treat your pets, to humanize them, but don't do that.
Thank you so much for listening to the Veterinary Innovation Podcast. If you want to hear about our new episodes, please follow us on any social media channel. Also, you can check out our website at veterinaryinnovationpodcast.com. See you next week.